Hi there, you're welcome to Detemir Care channel where we talk about medications and how to use them properly. If you're new to our channel, make sure you hit the like and subscribe button. That way you're able to get alerts anytime we post our educating videos, and that way you're able to join our Detemir Care community. All right, so what is our topic of choice today? So today we'll be talking about a medication called Levemir. So Levemir is known as a long-acting insulin that's used in patients who have diabetes in order to help regulate their blood glucose. So Levemir is usually taken by patients who have type 1 or type 2 diabetes in order to help regulate their blood glucose. So what are some of the side effects to look out for with Levemir? So Levemir can cause injection site reactions such as a rash, redness, swelling, or itching. This is very rare, and if this occurs, make sure you call your doctor's attention to it in order to help see if you're allergic to a substance in that Levemir medication, or they would have to change your medication to another insulin therapy. Another common side effect of Levemir is weight gain. This is very common among various insulin products, and you want to make sure that you're looking out and making sure that you're incorporating exercises in order to help reduce that weight gain that the insulin may cause. It doesn't happen to every patient, but just in case it does happen to you, it is a common side effect. So make sure that you're on the lookout for that. And like I said, with diabetes, you also want to make sure that you're incorporating lifestyle management, such as watching your diet, as well as exercising to help reduce this weight gain. Also, another common side effect is swollen feet, which is also known as peripheral edema. This is a common side effect as well. So make sure that if this is happening, make sure you call your doctor's attention to it so they can probably look into other therapies that might be beneficial for you other than insulin. And also, insulin can cause antibodies as well. So just to be aware of that. So what are some of the things that you need to be aware of while on Levemir? So most patients are usually on Levemir and they'll take this at bedtime as a once a day dosing, while we also have some patients that take it twice a day due to their A1C level or their blood glucose level. So just in case, just be on the lookout. This can be taken without regards to meal because it kind of regulates the insulin on a stable or constant pace where it doesn't just drop the blood glucose all of a sudden like the fast acting insulin. Also, with this medication, you do not want to mix it with any other insulin product. So if you are taking a fast acting insulin, you would have to inject that separately and not mixing it with the Levemir in the vial before using the Levemir prescription. The Levemir comes in a vial and also a flex pen. So whichever dosage form or format that you're using, you want to make sure that you're following the instructions. And usually with insulin, we would inject that in areas such as the stomach area, the butt, as well as the upper arm and the upper leg area under the skin, and areas where there are fatty tissues. So a common side effect of Levemir as an insulin product is lipodystrophy, which is known as fat tissue thickening or thinning that may occur due to injection of insulin in this area. So you want to make sure that you're rotating that injection site whenever you inject your insulin in order to avoid this side effect. Also, usually with Levemir, it is good for 42 days at room temperature, and once it's open, it's good for 42 days. So after 42 days, you want to make sure that you're discarding that insulin and reusing a new insulin, Levemir insulin product. Okay, so this insulin, like I said, may be kept at room temperature. And also another thing is you don't want to mix your insulin products together, like I said earlier, or share your insulin pens with another patient. So this is to help avoid the risk of blood infections such as hepatitis or HIV in patients. So you don't want to share pen needles or any sharps that you may have used for injecting that insulin. Also, what patients will do most time is get a sharps container where they just put that needle or syringes that they've used in order to inject themselves with the insulin inside that sharps container in order to help avoid the sharp needle getting into the wrong hands or being used by another patient. Also, with this medication, like I said, make sure you're monitoring for low blood sugar. So also you want to make sure that you're monitoring for low blood sugar, such as sweating, shakiness, blurred vision, or hunger in these patients. All right. Thank you. I hope this video was helpful in terms of insights and information regarding how to use your Levemir prescription. Make sure you hit the like and subscribe button in order to help our Detemir RX Care community and in order to help get alerts whenever we post our other educating videos. Thank you and stay blessed.